Joining us online will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking and introduce themselves each time they speak. If you have a public comment on an agenda item or under regular public comment, if you're in the courthouse with us today, we ask that you please come forward. If you're online, we ask that you use the raise your hand function on Zoom. Staff will call on you and unmute you. We ask that everyone keep their public comments to 3 minutes, and we ask that speakers give their name and address for the minutes. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. A recording of this meeting will be available on our website after the meeting. We will start today with our consent agenda. Would either of the commissioners like to pull anything off the consent agenda?
No.
Would anyone joining us today like to pull an item from the consent agenda? We were.
That was the question. This is Commissioner Reed. I move to approve the consent agenda.
Second.
All of those in favor, please say aye.
Aye.
Thank you. We will move on to general public comment. Does anyone have a general public comment not for one of our agenda items? We'll take public comment about the land text amendment and COVID-19 updates when we get to those items. But if you have general public comment other than that, please come forward. Do we have anyone online for public comment?
No.
Okay, we will move on to our regular agenda. We will start with item 3.1 from the Planning Department. Consider a text amendment TA 21-00107 to the subdivision regulations for Lawrence and unincorporated Douglas County. Do we have a presentation on this item?
Yes, we do, Commissioners. We're going to move Mary Miller and Jeff Crick into the panel for the presentation.
Good evening, Commissioners. I'm Mary Miller, City County Planner, and I will share my screen. I do have a PowerPoint. And the purpose of this amendment, this text amendment, is to bring the land divisions that are currently allowed within the City of Lawrence urban growth area into conformance with the recommendations in Plan 2040. And the comprehensive plan recommends the minimize the conversion of agricultural land to non-agricultural uses. It recommends that we maintain the rural character of unincorporated Douglas County. And the long-range plans recommend various densities of residential uses once a property is annexed into the city. The current subdivision regulations were written under the previous comprehensive plan, Plan Horizon 2040. This recommended that residential development in the unincorporated area be directed to the urban growth area. And so this amendment is intended to revise those land division processes in the subdivision regulations. And the subject of this text amendment is the highlighted areas, not the blue, that would be the City of Lawrence, but the green area is Tier 2. That's the area of the urban growth area that it's expected to annex first. And the tan area is Tier 3, and that's expected to annex secondly, and it's not all expected to annex within the lifespan of the comprehensive plan. Earlier this year, zoning and code staff worked with the county GIS department to gather statistics regarding the status of rural land. They looked at various things such as the number of parcels that were below certain acreage. This is some information they provided regarding the percentage of the total rural area of these parcels rather than just the number of parcels. As you can see, parcels that are lower than 5 acres, between 5 and 10 acres, between 10 and 20 acres are each about, they're less than 10%. The majority of the property in the unincorporated county are parcels greater than 40 acres. That would be about 70%. And this is good news if we're working to set standards to protect agricultural land. It's good to know that we're starting with a good inventory of agricultural land. And as the city of Lawrence has slowed annexation, this has resulted in development pressures on the unincorporated portion of Douglas County. And this chart shows the number of residential or rural development parcels that were created since 2006, December of 2006, when the subdivision regulations were revised to permit certificates of survey. They stayed fairly constant. There were spikes in 2016 and 2018, however. The total number of certificates of survey or parcels that were created since they were permitted is 148. And the zoning regulations were revised in February of 2020 to require a rezoning process before a certificate of survey could be conducted. Cluster certificates of survey in the urban growth area are permitted only on land that is zoned CP, cluster preservation. Rural certificates of survey outside the UGA require Ag 2 zoning. The rezoning process takes the agricultural productivity or potential of a property into account, along with other review criteria. And staff provided at the work session and at various other meetings, images of rural land that annexed but has not yet been divided into smaller urban parcels, and land that is adjacent to the city limits that has not yet annexed. And the concern is that allowing land divisions and residential development on 3-acre lots in the urban growth area may limit or slow annexation and may hinder the division of land into urban density after annexation. So 2 options were proposed in the staff report to address this concern in each tier of the urban growth area. And in tier 2, one of the options is that all new land divisions through the subdivision regulations be prohibited until the property is annexed into the city of Lawrence. So the only land divisions that could occur are those that are exempt from the subdivision regulations, or if a property had already been divided through a certificate of survey or through a plat, the lots could be reconfigured and it could be replatted, or the certificate of survey could be amended, but there would be no new land divisions. The other option would be to revise the build-out plans to ensure that city services could be extended efficiently throughout the area when development is proposed following annexation. And the staff report in your packet showed kind of a review of the build-out plans that were provided with the certificates of survey. We have not had any properties annexed yet that had build-out plans, so we can't point to any concrete examples to say if they're working or not. But looking through them, one issue that we identified is that when we show them to the block level, rather than the lot level, it may not be possible to have sanitary sewer lines extended along the rear of the property lines. And so one of the recommendations, if we revise build-out plans, would be to show the future layout rather than the block level, show it to the lot level. And then put a 15-foot wide, either an easement or just exclude that area from the building envelope. So that's where the sanitary sewer line could be extended following annexation if the property develops as shown on the build-out plan. Another change that's recommended is that the city engineers be included along with county staff in the review of the certificates of survey so that they could review the build-out plans. And tier 3 options are fairly similar. The option to revise the build-out plans are exactly the same. The option for land divisions, to restrict land divisions, would be to prohibit any new cluster development certificates of survey in tier 3, but to allow land divisions to occur as they do in the rest of the unincorporated county with a rural certificate of survey. And the difference is that a rural certificate of survey is much simpler. It has a different density and dimensional requirement. If you have 20 acres, you can divide it into 2 parcels buildable for residences. A minimum parcel size of 10 acres is required. There's no future development area or temporary set-aside agreement or build-out plans required. So it's a simpler process, but you get less density. The changes to the zoning regulations, which require that the agricultural productivity or potential of a property be considered when rezoning from the Ag 1 district, appears to have slowed divisions. However, option 1 for both tiers This option would prohibit the more dense rural development that is possible with the cluster development certificates of survey. That's the option that is being recommended by staff. And this would reduce the possibility of more dense residential development in the urban growth area by setting the minimum size of new parcels at 10 acres in tier 3 and not allowing any new residential development in tier 2. And this would allow the conversion to more dense development upon annexation to be done more smoothly. Rezoning from the Ag 1 district to the Ag 2 district for those certificates of survey in tier 3 would still require evaluation with the LISA system and a evaluation of suitability of the property for agricultural uses. And the LISA system will be before you shortly. It is going to the Planning Commission in August, so it should be before you for consideration within the next few weeks. Note if the recommended draft language is approved, the one that prohibits divisions in tier 2 and then changes the type of divisions possible in tier 3, it would also be necessary to revise the zoning regulations to note that there could be no new rezonings to the CP district. We would keep the CP district, so we would have the standards for when a certificate of survey is amended or a property is replatted, but there could be no new rezonings. The Planning Commission voted unanimously to forward this text amendment to the Board of County Commissions with a recommendation for approval at their June meeting. And this amendment is being provided to the County Commission at this time and to the City Commission for discussion. The amendment will be brought back to the commissions for action once the other amendment that's being processed to the subregs, that being the Eudora UGA, once that is completed. And that amendment is expected to be on the City Commission on August 17th. That should be one of the final steps. And then this amendment will come back to the County Commission and the City Commissions for action after that. And I'd be happy to answer any questions if you have any for me, or to take any direction if you have any direction.
This is Commissioner Portillo. Thank you, Mary. And you mentioned the LISA system, which we've had a number of conversations about, but we have quite a few visitors with us today. Would you please just walk us through what that looks like and how that would be used, particularly in tier 3?
Yes, the LISA system is the Land Evaluation Site Assessment System. Many counties use that, and we work with the Natural Resource Conservation Services to develop one. We have a draft one ready. We have used this with the rezoning since the zoning regulations were revised, but it allows you to measure based on the U.S. Department of Agricultural information, the agricultural productivity or potential productivity. So we look at things such as, are there prime soils? What percentage of the property is prime soils? What percentage is soils of statewide importance? And what percentage is not prime soils? And we look at the productivity such as the National Commodity Crop Production Index to know like what rate of growth or production is there on the property. And we, in the LISA, it's kind of a scoring system. So we establish scores for various degrees of productivity. We also look at the range production. We look at one or the other, either the commodity crop or the range production, depending upon which one is greater. We look at the soil class, if it's soil capability class 1 or 2 or 3. And these all go together to discover the soil potential. Then we look at other factors such as how far is it from city limits? How far out is it in the urban growth area? We're trying to give a less value if you're closer, more likely to annex sooner. We look at, are there any constraints? Are there wetlands, stream corridors, very steep slopes? We look at what is the property used for now? So if it's currently used for agriculture, it'll get a higher value than if it for some reason is not used for agriculture. And at the end, we have a spreadsheet and it gives us a final score, which can be ranked as very high importance for protection, high importance, medium, and low. And this is to be used with all the other review criteria. So if your property ranks very high for importance for protection, it could possibly have a rezoning approved if there was some pressing reason, if there was something else, for instance, if it was in an area that was completely developed with similar types of land divisions, but it would be less likely. If you had a lower score on the LISA, then that would be more favorable for a rezoning, but it would be taken into consideration with the other review factors. that it is an important tool that we are pretty excited to be able to use, so we don't have to look at it and try to make a subjective determination. We're just going to rely on the information that the Department of Agriculture has provided us.
Thank you. Are there questions from other commissioners?
This is Commissioner Reed. Thanks, Mary, for all of that. I was curious if the option where the zoning would need to be changed so that no new cluster preservations happen, do we, and if you said it, I apologize for missing it, have a number of approved CP zones currently in the county? It's okay if not, or even just an estimate, you know, like, I mean.
Right.
Few-
Mary Miller, City County Planner. Actually, everything that was zoned A1 and it was in the urban growth area and even outside the urban growth area converted to CP. And so anything that had a certificate of survey done on it, so all those certificates of survey that I showed in that chart, those all have CP zoning. I believe we only had one CP zoning approved since our zoning regulations changed. So we have one new one. We don't have anything in the process right now. We do have a person who's interested in submitting an application. They may be submitting it. And we've informed them that this discussion is going on, that we don't know just how this will work out. So, but other than that, that's the only one we have that's kind of in the works.
Okay, thank you. And then could you just in a little bit more detail talk about some of the exemptions, like if approved as recommended by both staff and the Planning Commission, can you just explain the circumstances of some of those exemptions for landowners?
Sure, you have some pretty standard exemptions. For instance, cemetery land, there's an exemption to allow you to divide off land for a cemetery and you don't lose your vested right to build on your property. Right of way, there's an exemption for agricultural land divisions. You do lose your right for building permit if you divide for agricultural, but you don't have to go through any process. You just do a survey with the county surveyor and record it. Some of the more that apply more to residential, we have the Homestead exemption survey, and this allows you to divide off, if you have a 10-acre parcel or 20-acre parcel and a house, and you want to divide off 3 acres. Sometimes people do this for mortgage purposes. Sometimes that's all they want to sell. They want to keep the other 10 acres. You can do that, but you have to sign an agricultural natural resource protection agreement, which basically says, I will not develop the remainder of this property, but I can sell off the piece with the house, but that way you're not getting a new building permit. So the density stays the same, but we're not requiring people to own 10 acres if they only want 3, but we're able to keep our density. And the same thing happens with the agricultural subdivision boundary exemption. And that is allowed in the Ag 1 district. When we did the zoning regulations, we wanted to find what number we thought would be good to allow people to divide their land to without having to go through our process. And we set on 20 acres. And I know zoning and codes are monitoring that, see how many 20-acre parcels are being created to see if we've made the right choice with that or should it be increased later. But if you divide your land into 20 acres, provided you have the right amount of road frontage and you go through the certificate, not the survey, but the county surveyor, then that is exempt. And so you can divide, if you had 80 acres and the right amount of road frontage, you could divide that up into 4 20-acre parcels that could be built on.
Thank you, Mary.
Mary, if this were to pass, did you think we would only use the LISA tool for subdivision regulations? Is that what you're thinking?
The LISA would be used primarily for anytime you rezone out of the Ag 1 district. So if you wanted to go to Ag 2 or commercial or industrial, and if it was a conditional use permit that was going to be a permanent use, we may use it just to evaluate that to see what would the impact be. But primarily it'll be for those rezonings. Anytime you rezone land from agriculture to any other zoning district.
Thanks.
And yes, it would primarily be for a future land division.
If those are all the questions from commissioners, we'll open this up for public comment. Do we have anyone here in the courthouse with us who would wish to make public comment? Please make sure that the microphone is turned on. Just press the button until you see the green light and provide us with your name and address.
Okay. Good evening, Commissioners. My name is Bob. Can you hear me? My name is, okay, better. My name is Bobby Flory, and I represent the Lawrence Home Builders Association. I reviewed the proposed text amendment from various perspectives, though. One, from a housing perspective, obviously. Also from an agricultural perspective, because my husband and my primary source of income is from the farm, from full-time farming. And also from a planning perspective, as a past planning commissioner who served 8 years and also worked on the Horizon 2020 Steering Committee. The proposed text amendment may meet some of the vision and goals listed in Plan 2040, but it ignores many others related to growth and housing. Plan 2040's growth management vision states, our vision is to manage growth within Douglas County by encouraging agriculture and accommodating the demand for other compatible uses while protecting environmental resources. Plan 2040 clearly recognizes the demand and need to provide housing in the unincorporated Douglas County. Plan 2040 also calls for the protection of environmental resources, which will be limited by this amendment because creative land use planning through cluster development, especially on unique sites, will be prohibited. Plan 2040's growth management goals state minimize agriculture land conversion to other non-agriculture uses, and that was listed in your staff report. Then the very next goal is cluster residential developments to preserve agriculture land within the UGA. Plan 2040's residential vision states both Douglas County and Lawrence are desirable residential locations. This plan promotes a balanced mix of housing throughout the community, allowing for a wide range of housing types and residential densities based on the surrounding context. Plan 2040's vision did not call for residential growth in Douglas County to only be for those with wealth. It calls for a mix of development. Plan 2040's residential goals outside UGA, one states ensure a variety of housing types, provide housing opportunities while conserving overall rural character of density. Within Tier 3, require residential development to cluster. I'm taking these right out of our adopted Plan 2040. Within Tier 2, require cluster residential development when not reasonable to be annexed, maximizing open space and preparing for urban development. Requiring annexation in Tier 2 and removing the option to cluster development in Tier 2 and Tier 3 is not consistent with all the visions, goals, and strategies identified in Plan 2040. As you can see, I went through Plan 2040 and picked out some of the goals and visions that support my position that this text amendment is going too far. And I would say to you that the planning staff has done the same thing to support theirs. So in other words, we can pull different things out of this to bring about a different message. And the idea of providing a build out for the cluster developments, the 40%, staff feels that they don't have enough detail. And I would say that there are times that we should continue to do that, because there are times where we can get conceptual plans, but to get the level of detail that the city engineer might want to review and the county staff, that information is just simply not known. So it turns into expensive engineered guesswork. So we'll be paying an engineer to be providing detailed plans based on information that's just simply not known at this time. And to conclude, I'd like to say that I do understand the pressures of development and growth out in the county. As a county resident, I do understand that not all roads are designed to handle the density that we have. But I also would like to say that we've gone too far with this text amendment by prohibiting opportunities where it might be very appropriate.
We want to make sure we can hear from everyone, and you're over 4 minutes now.
Okay. Instead of working so hard to prohibit growth in Douglas County, you should try to work together with the city to find ways to accommodate the demand for housing in areas where you do want it to occur. Thank you so much.
Do we have anyone else for public comment in the courthouse today?
Is this okay? Good evening, Board of County Commissioners. My name is Mary E. Wakeman, property owner of record on track plate number 199 CA, located within Douglas County and Tier 3 of the Plan 2040 Urban Growth Area. Myself, as well as others within the city and urban parts of Douglas County, are strongly opposed to the current text amendment recommendations brought forth from the Planning Commission. Both revisions merit the continued old thinking that has been in place for decades, having the time of placing the inevitable current housing crisis on hold due to it serves no purpose or thought into the suitable solution that needs to happen now. It does not serve the current housing problems faced to the city of Lawrence for future growth and expansion of this community. It further restricts more unwarranted governing limitations to landowners' rights. It dictates what is suitable use of landowners' property. It limits the full potential of the landowner's rights. It confines the ability to work with entities on what can be done within the surrounding properties. To be put quite simply, it appears these revisions are merely a permanent solution of administering a complete moratorium on growth for this community. New businesses that are looking to this community will offer more jobs, more opportunity, and will bring the demand and crisis of housing even higher. Again, to mandate a text amendment as in Tier 2 that prohibits a landowner to divide their property until it's annexed into the city, and then to completely prohibit any cluster development within Tier 3 is a complete and unsensible approach to resolving future growth for the city of Lawrence and the urgency for expansion needed now for this community.
You're at
In
3
summary,
minutes.
key
Please
points to
wrap
a
up.
sensible resolution would be to deny this amendment, work collaborative with entities around, including those that elected you to office, work in a sensible approach to catch up that is orderly, a work in progress, and merely the reality needed for this community. Lastly, implement a sensible plan that benefits everyone, not just the governing entity. Thank you for your time and your considerations.
Do we have anyone else in the courthouse for public comment on this item? I would remind everyone to please keep your comments to 3 minutes or less.
Okay. My name's Michael O'Shea. I have land in Tier 3. I just want to agree with the previous person's comments on all that they have said. Okay.
Do we have anyone else here in the courthouse for public comment? Okay, do we have anyone online for public comment?
Yes, Commissioner, I'll be moving Danielle Davy over first. Danielle, go ahead and unmute yourself and speak.
Good evening, Commissioners. My name is Danielle Davy. I speak to you tonight in my capacity as the Governmental Affairs Director for the Lawrence Board of Realtors. The Board of Realtors has serious concerns regarding the text amendment you're considering this evening. As you undoubtedly have heard from realtors you know, seen in the newspaper, or perhaps experienced yourself, Lawrence, like much of the nation, has a significant housing shortage. Currently, the Lawrence market has 1.2 months worth of inventory, which is approximately 3 months short of the inventory we need for a healthy, balanced market. This lack of inventory, combined with the increasing demand, has resulted in an environment where multiple offers and offers over asking price are the norm, meaning rapidly and artificially inflated housing prices. For example, from 2019 to today, the median sales price in Lawrence has increased from $214,000 to $265,000. This problem is only going to get worse and housing more expensive if Lawrence and Douglas County don't take decisive action to meet housing inventory needs. I say all this because the text amendment you're considering this evening will, while undoubtedly well-intentioned and understandable from the perspective of planning for future urban growth, will result in additional constraints on housing development and in particular, the development of affordable housing. In addition, the text amendment as presented will significantly constrain landowners' use of their own property without providing any meaningful information or data to the city regarding future potential development. The planning goals of this text amendment can be less restrictively achieved by requiring conceptual build-out plans for future development with any subdivision request, an option which was presented but not recommended by staff. If our community truly values and prioritizes affordable housing, then we should be working collaboratively and proactively to plan and facilitate the future development we need, not adding additional regulatory barriers. And so we would encourage you to reject the text amendment as presented tonight and consider a less restrictive option. Thank you.
Commissioners Ward Lyles will be moved into the panel next. Mr. Lyles, go ahead.
Thank you very much. My name is Ward Lyles. I am a member of the American Institute of Certified Planners, a Lawrence resident, and a professor of public affairs and administration with a specialty in urban planning at KU. One of the things among many that I teach relates to land evaluation, site assessment, and land use planning. I'd say I'd speak in favor of the text amendment. Much of the land development patterns that this text amendment would constrain, or what we would characterize as suburban sprawl. It's an unsustainable land use pattern. It impairs natural resources. When you invest in pavement and land fragmentation, you undermine working landscapes as well as natural landscapes. There's robust evidence that low density development patterns are a loser for city and county government over time because you provide services at an inefficient rate. And I believe that arguments in the realm of driving up cost of housing and not meeting affordable housing are largely red herrings, that those are not supported by the literature. And I would actually argue that this text amendment may not go far enough, if anything, in terms of ensuring that we can have a more sustainable community at the county. And last, I'd conclude by saying that the evidence presented on Monday globally from the Intergovernmental Panel on Climate Change makes it unequivocal that we need to reduce our reliance on fossil fuels. These low density development patterns exacerbate our reliance on fossil fuels, goes exactly against what we need to be doing as a community right now. Thanks for your attention.
I'm not seeing any other folks with raised hands in the attendee panel.
Okay, do we have anyone else here in the courthouse with us for public comment on this item? Okay, we'll bring it back to commissioners for discussion. Thoughts?
I actually have a delayed question from Mary, and that I should have thought to ask before. Can you help us understand the specific thinking of why you landed on option B for both of them versus option A, and what you think the primary benefits of going with option B for both tier 1 or tier 2 and tier 3 are?
Well, I think they're both possible options, but I think staff landed on the option to restrict or limit the land divisions just in it's not so much as to slow development, because the rezoning requirement would do that. With every rezoning, we would look at where is it, what's the agricultural productivity, but more for making it easier when land gets annexed for it to develop. And when you look at the type of houses that are built on the property that's divided through certificates of survey, they're typically not affordable housing. Now, there is a 40% set aside, so it's possible that when it comes in the city, affordable housing could be built on that portion. But just comparing the things and balancing the issues, it seems that having more land that needs to be divided when it comes into the city, and we have to wait until a developer is interested in dividing it. Just because it annexes doesn't mean that people are willing to sell their houses or want to divide it. So we could have a lot of these large lots. Now, I know in tier 3, it's not expected to annex for quite a while, so there could be a lot of development happening. And so the amount of land divisions that could occur within the next 20, 30 years, when the city, if the city does get out and want to annex some of that, we could have it completely built up, and we don't have long range plans in place right now to know where are we looking for high density residential or where are we not looking for residential. So it just seemed more appropriate just to recommend limiting the land divisions.
Thank you. That's helpful.
So I might just offer some comments. I sat on Plan 2040 and I heard some of the same conflictual conversations around the very ideas and thoughts that are in Plan 2040. I thought Bobby Flory's comments about there's not a consistent message within 2040. There's conflicts within 2040. I think sometimes when we use language about what we want in Douglas County, we forget that the city of Lawrence is in Douglas County. So some of those statements, I believe, that are in Plan 2040, such as a mixed use of housing, really are relating to all of the housing within Douglas County, including the city of Lawrence. I want to make sure people understand that if we move forward with this, we're not saying there's no housing development in rural Douglas County. You can still build a house out there. And you can still build different types of housing, though probably not apartments and things like that. What this seems to address is what we've seen over, the past 2 decades. And I thought Mary's chart at the beginning was a great example of this ramping up we've seen of dividing lots in rural Douglas County and the pushback we've heard from the residents that live there, and those who care about a commitment to rural property. And I think that's what Plan 2040 was about. If we need to develop more housing stock, the city of Lawrence needs to annex property so that we can develop more housing stock. I don't think it is something that we need to do to the detriment of those who want to preserve a rural setting. I know there's pressure on the city to do that, and I know that's hard to do and it's expensive to do, but I think it is good land management, and I think it's a good plan for Douglas County.
I appreciate you sharing your perspective, Commissioner Kelly. This is Commissioner Reed here, and I was looking forward to hearing your perspective as somebody who has been a part of this conversation for a long time as a commissioner, and also a former planning commissioner who sat on the Plan 2040. So, I tend to agree with you, and I think that I appreciate all the time and energy that staff have put into figuring out how to make sense of the sort of conflicting language that existed and that was creating issues for these processes. And so I do think that this addresses it. And Mary, I appreciate your further explanation about the various options, but why ultimately the restricting of development felt like the smartest way to really plan for that growth in an efficient way, and that still that has these different processes in place. So thanks for walking us through that a little bit more. I have also appreciated the Planning Commission's conversation and watching that meeting, and the acknowledgement from many of the commissioners there that these conversations have been happening for several years now, sort of an ever evolving conversation, which I think is the nature of the work to some degree. And this is an opportunity for us to make it so that staff, as well as the planning commissioners and then governing bodies, have some clear direction about how to move forward with smart growth in a way that does promote affordability, as well as efficient infrastructure.
This is Commissioner Portillo. I appreciate both of your comments, and in particular, Commissioner Reed, I think you're right on when you're talking about the clarity that this provides, because there have been a lot of conversations, and how do we think through a really clear message when it comes to expectations for short-term and long-term growth in all of our communities. So I also hear what Commissioner Kelly has said, that this does create more pressure in Lawrence and Eudora to think about annexation as we think about growth for some of those affordable housing issues, to make sure that we have the kind of density that we need when it comes to building up housing stock in our community. So I appreciate all of the work that staff have put into this and the really thoughtful discussion from the Planning Commission as well.
This is Commissioner Reed again. I also just wanted to add that I also appreciated as part of the Planning Commission conversation that well, Eudora is kind of urban growth area, and planning process is still a little bit in process during that June meeting and has since been finalized. And so I appreciate all of the work of different communities and the staff to make sure that there's continuity in that language, and that there is kind of a shared approach. I think that that was really smart also.
I might just add one more comment. I think one of the challenges that we have is, as a governmental agency, is recognizing where the work needs to be done. I think that's going to be a theme in our next agenda item as well. You know, in order to increase our housing within Douglas County, the majority of it is going to need to come from urban development within the city. And so I think that's something that, while it may be, you know, it may be good, it may be a good strategy to put pressure on the county commission to keep that pressure, you know, to keep that release valve open. I think it's important to say that I really do think, I appreciate you adding Eudora in there and Baldwin and those other communities, that if we think we need to increase our housing stock, those communities need to take on those infrastructure costs and annex that land to do that. I just don't think that burden should be placed on that agricultural land. Once it's gone, it's gone. And once it's developed in a way that we can't urbanize it, and we have little pockets of that all over our current city limits, I think that that's just not good planning, in my opinion. I think it relieves pressure, but it's not good planning.
This is Commissioner Portillo. I think it's important you used, in my opinion, on the end of that. I think it's not just your opinion, it's also the opinion of our professional planners and professional planners in our community. And that is an important piece of this.
As Commissioner Reed here, I will move to approve text amendment TA-21-00107, revising the subdivision regulations for Lawrence and the unincorporated areas of Douglas County, Kansas, as noted in the attached staff report, to prohibit land divisions in Tier 2 until the property is annexed into the city of Lawrence, and prohibit any new cluster development certificates of survey in Tier 3, but allow rural certificates of survey, and provide direction to staff. I don't know if I needed that last part.
Second.
All of those in favor, please say aye.
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 Oh, Mary, were you hoping to jump in there?
Yes, It's actually before you today just for consideration and discussion. It'll be back before you to vote and it'll have the resolution ordinance with it. But
Sorry, Mary, we had it in our agenda as a recommended motion, so we.
I'm
probably-
sorry. Yeah.
As a practice round. Thank you, Mary.
Thanks, Mary.
Well, wait a minute. What do we do now, Sarah? Do we need to withdraw that?
I mean, Mary, I think that gives you the direction as to
Right.
wording of the text amendment, and then the official text amendment resolution will come back with a resolution number and we'll do it again.
Okay.
Thank you.
Okay, we will move on to item 3.2, a COVID-19 update. I believe Public Health is with us today to give that update.
Thank you, Commissioners. We're going to move some folks into the panel to provide an update for you. Moving into the panel is Dan Partridge, the Director of the Douglas County, Lawrence Douglas County Health Department, Brad Finkeldye serving as legal counsel for the Health Department. I believe we have Public Health Officers Thomas Marcelino and Dr. Jennifer Scrimshire here as well. I think we have Director of Informatics, Sonia Jordan, Robert Benecki, who is our Director of Emergency Management, who's been engaged in these conversations. Oh, who else did we invite? I think that's really at this, how we originally had envisioned that this conversation would go is it'd be a conversation and update for the commission on sort of the status of our community health related to COVID-19 and allow an open discussion with the commissioners and our public health team to talk about where we are and next steps. So with that, I believe I'm going to turn it over to Dan. Do you want to say a few words to start it off, or I'm not quite sure who is planning on giving the initial update?
Thank you, Sarah. I'll say a few words, but I think our order was to have Dr. Scrimshire kind of talk to us about an update around the epi side of this conversation. Dr. Marcelino will kind of follow up, and then I'll kind of clean up at the end. So Dr. Scrimshire, would you mind getting the conversation started?
Yeah, do I start the PowerPoint or?
Yes,
I don't
Dr.
have the
Scrimshire, if
updated one.
you've got a PowerPoint that you want to share, you can share your screen.
Sorry, I was not prepared, Sarah.
That's all right.
Trying to remember what the first slide even was. Oh my goodness, I've slept since then. So sorry, guys. Dan, you want to fill the?
Sure. Let me just kind of talk about something that I think is a good kind of tool to think about as we go through the conversation. Last week, we released to the public, it's on our website, what we call a community transmission indicator. It just rolls off the tongue, I know. But essentially, it's an outgrowth of the conversations we've been having with Unified Command and particularly school superintendents around guidance for the opening of schools. And if you recall, we had a gating criteria tool from last year that talked about being in green, yellow, orange, red. And so from that meeting, the direction we took was to simplify that tool and broaden it from just being useful for schools to be more around a community tool of helping the community understand what is the risk, current state of risk for COVID in our community. And so we went to a red, yellow, green approach, and we simplified the metrics for that. And the metrics are really what's our active case count and what's our 14-day rolling average of new cases. 25 and below as far as a active or a rolling average for new cases would be green, and under 500 active case count would be green. Yellow is between 500 and 1,000 of active cases, and between 25 and 50 new cases a day. Putting that into perspective, Right now, we're at 29 active cases a day being added, and an active case count that's over 500. So we moved into yellow from green based on that scale late last week. And so to move to red would be not a doubling, but close to a doubling of where we are. In that tool, when we talk about, well, what might you do and what might be triggered at each of those different phases or colors. And so in green, we talk about everyone should wear a mask, when they're in public spaces, if they're not vaccinated. In yellow, we say everyone should wear a mask, even if they are vaccinated. And then in red, we talk about consideration of public health orders when we get to that level. There's some other things in there. I'm trying not to just go through every little detail. And so that's been the kind of framework that we put together over the last month. And I think if Dr. Scrimshire, you're ready to jump, it looks like you are, we can kind of go back to, what is the incidence and trends going on right now. So I'll turn it back to you, Dr. Scrimshire.
I couldn't unmute. Okay. This is just a review of what we've been seeing to this point. What I mainly wanted to draw your attention to is the fact that we've had a rapid rise in cases recently. This is nothing new, unexpected. This is what's happened in multiple locations throughout the country and will continue to happen for the near future. But we were down to a 14-day average of 1 case per day. And even at early, a month ago, we were at 30 cases. I'm sorry. No, I said that correctly, but 1 case per day, and then active cases, which I think is an excellent number to look at. 30 cases, active cases, compared to nearly 600. And this was a couple of days ago. I don't know the newest number, Dan. I'm guessing it's well over 600. To expand a bit on the Delta variant, I'm sure you guys have been bombarded with news about Delta. This is something we saw coming out of India and has been a concern. The chart on the left shows you that we have essentially 99, I think it's like 98% most recent numbers. Essentially, for all intents and purposes, we have nothing but Delta in the state of Kansas. This was looking at about 3% of the total specimens sequenced for the month of August, I believe. For Douglas County, I think there's a lag. There's a couple of things that are happening with our variants. One, we do not send every specimen to be sequenced. So the number sequenced does not reflect the total number of cases we've had. The other thing is there was a large number of specimens that has been sent to KHEL, the state lab, for sequencing. So the number that they are subsequently sequencing are not, bottom line, we're not getting as much data back from the state. So I'm assuming that we have well more than 52 cases of Delta in our community. For hospital capacity, there's a couple of things. Yes, we're seeing an increase in COVID patients, but we have a ton of patients in the hospital at baseline. Yesterday, I believe we had 100 beds occupied out of 140, which is our baseline, not surge conditions. And today we have 8 out of 10 ICU beds. I think we're using the same number of NIPPV and MV that I just did not want to write out. Those two instruments are things instruments we can use to ventilate people when they need to be put on mechanical ventilation. So we're at about 23% capacity for that, but we have 2 ICU beds and in like 40 beds, non-ICU beds. We've doubled our admissions on Saturday. I think from Friday to Saturday, we went from 6 or 7 to 14. Currently, we're at 15 patients, 3 in the ICU. 2 of those are ventilated. We do somewhat keep track of our vaccinated patients. Today, that number is we only have 3 that are unvaccinated out of the 15. I think this is a bit misleading when you consider the number of people that are vaccinated in the county. You're going to get more people that are vaccinated that end up getting admitted. Looking at nationwide numbers, there's still only about 1% of vaccinated patients that end up getting admitted to the hospital, which is compared to 20% of unvaccinated. Trying to look at future trends, this is maybe the most one of the most frustrating things that we look at. I can't remember my phone. You know, there were reports of some leveling off on the new cases. I think part of that is because there's like waves that happen, like groups of states or areas that kind of catch fire subsequently. So I think, like you see on the left, see how the large peak has 3 kind of notches in it. I think these were waves of groups of states that kind of evolved. Below that is the number of new admissions. That's going to continue to rise. We see new cases, and we see hospitalizations, and then we see death. For forecasting, as you can see, the models can give you a wide array of potential. I don't know that I find any of these models terribly useful anymore. And I don't think any of these account for K through 12 and colleges and universities returning. This is from earlier this week. I just wanted to show you some of the stuff that we look at. Right now, there's reports that Kansas City, KC Metro, and potentially the rest of Kansas is in a leveling off phase. That is not what we are seeing locally. That is not what they're seeing in Kansas City. And for on the upper right, you can see how unpredictable the data gets. So those big, the orange line, those big sways, means that's not very terribly reliable. It could work. It could get higher, it could go lower, but nobody really knows. The report we got earlier this week was that, like I said, we have a possible leveling out, and that this current surge may persist over about 4 weeks. And I already spoke about the volatility in non-metro areas of Kansas. Last week, I and one of the people I work with at LMH on forecasting modeling, we tried to choose we looked at Boone County, and essentially it is compared ourselves to Boone County. We have almost the exact same percentage of our population vaccinated. They have more people in their county, but it's somewhat rural with a large university. So, and they got to experience Delta before we did. So 1-to-1, looking at their Delta surge and what we might see, looking at percentage increase over time. His name's Justin. He came up with a peak of about 14 or 15 inpatients daily, but maybe a longer peak. We hit that on Saturday. So I don't know that that's going to be our top, but that would be great. Doing a direct comparison and the fact that we have a more Boone County looked like they spread their surge out over a bit of time. Ours looks to be compressed. So I thought maybe we would rise quickly and get it perhaps into the mid-20s, but hopefully not stay there for long. This is just to try to anticipate how long we're going to be in this surge. I'm going to start labeling with the variant. So I'm going to start calling this the Delta surge. Looking at the two big ones that have happened since it started were India and then the UK. Just know that data is normalized. It's per million people. Looking at the previous surge back in November, this one lasted about 5 months, or maybe not quite 5 months, but this was a more protracted course. We saw a huge rise in October. We hit our peak in November, and then really didn't quiet down until February, March. But for this Delta surge, India, from April 1st to June, the beginning of June, so 2 months. And then look at the UK, they had like a month, like early July. If you want to go back into mid-June, fine, but that is a pretty compressed surge. And so I'm hopeful that ours will be quick. I relate this to the burn, I call it the burn rate, not just me, but when you're discussing infectious diseases, how quickly do things get transmitted? How quickly do they burn through the population? This one is infectious enough that I think it'll go quickly. There will be a high number of cases in a short period of time, but we should pass through it relatively quickly compared to our previous surge. And I'll be happy to advance the slides for whomever.
So this is the community transmission indicator. Dr. Marcelino, health officer, that Dan was referring to, that we put out last week. And it's our attempt to simplify things to give a firm indication as to where we are as a community. As Dan said, we've moved from the green to the yellow based on our 14-day moving average and case count. So we're recommending everybody inside wear masks regardless of vaccination. And when you're outdoors in public places, around people, masks are recommended. So any events that are going to put you in close proximity to anybody else. Red, obviously, we hope we don't get to red, but as we get to red, then we would consider more stringent, strict measures. You can advance the slide, Jen. So this just outlines kind of each of the categories and gives some of the guidance. This can be found on the Lawrence Douglas County Health Department website. And I believe there's also a link in the paper here recently. So you can advance the slide. So one of the things we want to talk about is vaccine. There's been a lot of myths out there that with the Delta variant circulating, with us now recommending masking for vaccinated persons, that people are saying that why get vaccinated? But the reality is that vaccine is still effective against the variants that we have, the Delta variant. Vaccine reduces the risk of severe disease, hospitalization, and death, and that's the point that we need to make sure everybody's aware of, that vaccine is effective, and millions of people have received the vaccines and the most intense safety monitoring in U.S. history, and they're safe. So our message really is, if you're unvaccinated, get vaccinated. And the reason we have to wear masks now is you still can spread the virus even if you are vaccinated. Usually you would have to be more symptomatic to do that, but with the Delta variant, we recommend masks across the board. So that's what came of that. Next slide. So this is just a slide that came out here recently from the CDC. CNN had reported this, that the numbers really would say that 99.99% of people that are fully vaccinated don't have a breakthrough case resulting in hospitalization or death. So, you hear of all of these cases, and part of that is because we've vaccinated so many people that we're going to have these breakthrough cases. So if you look at that, you're looking at 7,101 people that were hospitalized. Very few that were vaccinated died. And most of those were in the senior 65 and over. And that's something that we want to continue to message, is that, yeah, there are breakthrough cases. Yeah, We do see hospitalizations, but the overwhelming majority, 99.99%, the vaccine is effective and does what it needs to do. Next slide. So, this was according to the KDHE website. If you go to their data, this is where we are as a county. There's different reports if you look at different tracking systems, but we're at 622.9 per 1,000, and that's just one dose. If you look at the completed 2 doses, it's a bit lower. So we want to encourage people to get that second dose. And so vaccines widely available. That's the message, and that's what we want to promote. I think I was going to turn it over to Dan here at this point.
Yeah, thank you, Dr. Marcelino. And I would just add a couple of points before going on to my piece of this. Last night, we did a panel discussion for the community, and Dr. Scrimshire was part of that panel. And, I learned something that I found very interesting that I just want to share again today, because, currently to date, we've had over 10,000 COVID cases in the community. And that means that hundreds, probably thousands of people have gone to their physician with COVID during this timeline. And last night I learned that less than a handful of people who went to their physician when they started being symptomatic, before it got too severe, they never hit the hospital. They never were hospitalized. They were effective treatments that kept them at home and until they recuperated and recovered. So I think that's a message that we probably haven't talked about enough. We talk about if you're symptomatic, stay home, but I think we need to add to that, if you're symptomatic, consult your physician and get effective treatment timely. We also talked about vaccine safety and vaccine efficacy, because we've put in thousands of staff hours over the last 2 months trying to be everywhere for everyone when it comes to getting a vaccination. We've put in far more hours than we have gotten vaccinations. A typical event for us is 2-3 staff members go out and spend 3-4 hours and do 0, 1, 2, 3 vaccinations. And so when we think about how do we reduce the burden of COVID in our community, there's 2 big tools: vaccination and masks. And we need to not focus on one tool, but always try to be leveraging both of those tools. And so there's a lot of work to be done on trying to improve vaccination rates and reach out to those people. When we look at who's vaccinated and who's not, it's a real clear message. Everyone over 65 is vaccinated. Everyone between 35 and 65, 3 out of 4 people are vaccinated in that age group. It's our 18 to 24-year-olds, where 1 out of 3 are vaccinated. That's where we see the vaccination rates really plummet. For our younger children, our 12 to 18-year-olds, it's about half. So we have work to do there as well. But so we need to continue to encourage people and change behaviors. And as we think about how can we do that, because the goal really is, how do we change behaviors? How do we break down resistance to masks, resistance to vaccinations? And there's a change theory out there, primarily more around maybe organizational culture, but I think it can be applied to community culture. And that is, the things that we experience and the beliefs that we hold drive our actions, which drive our results. And so when we go to, we just rely on public health order and we drive action through that, we're not taking advantage of experiences and beliefs that we can modify and adjust through education, awareness, promotion. And so we're working hard to figure out how can we make progress in that area. Because, as we led earlier, our transmission indicator tool right now says we're in yellow, and that's a time for increased doubling down on the efforts, if that's possible, to work twice as hard as we already are, but to continue the message of get vaccinated and wear a mask, provide that peer pressure. Let's do what we can to change a social norm around vaccination and mask wearing. That's the message that we wanted to bring to you tonight. And I think with that, unless Dr. Scripture or Dr. Marcelino, you have anything more to add, I think we're ready to stand for questions.
I was trying to get a number for what our actual the people who got a mono.
Oh, I'm sorry.
For what?
Okay, our active case count, back to the questions from before, which I forgot. 652 active case count, 29 average, 14-day average.
I was going to say the people who received monoclonal infusions. So these are the people who got diagnosed. They're generally higher risk for going on to develop complicated disease. They discuss it with their physicians or they're contacted by our clinic. We get them in, get them this quick infusion, and can keep them out of the hospital. And I was trying to get the actual number, and I thought maybe we had 3 that have gone to the ED and none admitted, but I wanted to verify that, and I haven't gotten a response yet. But bottom line is, I'm not saying that all of those people would have gone on to become hospitalized, but with the 10 ICU beds at baseline, every one of those infections that we can, mitigate or keep them out of the hospital means a ton to us.
This is Commissioner Portillo. I am incredibly grateful for that presentation and really appreciate all of the data. I also, as someone who studies organizations, just want to push back a little bit on that organizational change piece. Rules and policies do make a big difference. And so when we think about behavior and guiding behavior, it's not just about kind of thoughts and feelings, but the rules and policies that we have in place. And so I am a bit concerned with those numbers. When we're looking at the active cases, I mean, even in the 2 days that we went from what was on the PowerPoint 588 to where we're at now with 652, and we're looking at the rates that we have in our community, we're trending towards that red zone very quickly. And rather than kind of waiting until we get to that red area, I'm really curious about what are some of the things that we might be able to put in place now as a community to make sure that we're not getting there. I really appreciated the comparison with Boone County, but I did notice that Boone County is also a university town. They had their surge before students came back. We're at the severe disadvantage where we're in our surge and our students are coming back right now. We're also seeing the start of K through 12 schools where we have a really large unvaccinated population. And so I'm a bit concerned with the factors that are a bit different between us and Boone County, just given the timeline. I like the comparison, but the timeline is very different for our particular communities. I'm also curious, you presented quite a bit about the number of beds that are open. One of the things that we've been hearing about in the Kansas City region is that there are currently no open beds at Children's Mercy. And some of that is not necessarily related to COVID. We know that we have major RSV cases in our community. But is LMH prepared for pediatric ICU if we see a surge in cases for people who can't be vaccinated under the age of 12?
Would you like me to respond?
Yes, please.
Sorry, I never know if I'm supposed to talk or not. This is Dr. Scripture. Yeah, we have checked in. I've checked in multiple times over the past, month or so, just to make sure that we had everything in place. Do we have we keep track, to the item, we keep track of all of these things, from medications we use for COVID patients, PPE, staffing hours. It's all mapped out and reviewed regularly. But one thing we haven't done to this point is, are there differences in things like sedation we use for pediatric patients on ventilators? The ventilators themselves, the supplies that go with the vent, our transfer capabilities, staffing, do we have appropriate staff for peds? And yes, so I think that we are capable, absolutely. We have upped our, we've identified some areas where we can make a difference, like non-invasive ventilation supplies, and our transfer capability. It's a well-oiled machine, but it absolutely concerns me that we don't have any place to transfer to. So what I've asked is to identify some additional hospitals, maybe in Nebraska, that we could look at transferring to if we needed to. But we are ready for kids. I hate to say that. It kind of breaks my heart to even have to address this, but yeah, I do believe that we're ready. As far as staffing for the hospital at large, we have not changed our capacity number. We are able to shift around staff and open different units. In the beginning, we shut down electives and looked at reallocating those staff, and as well as decreasing the number of post-operative admissions, but that really didn't make a big dent. So this time we're looking at staff throughout the organization that has inpatient experience. So say this nurse works in the clinic currently, if they've worked in the ED or inpatient unit previously, can they be moved to inpatient if we need them? So yeah, I mean, I'm happy with the amount of work that we've put into all of our surge planning, how nimble we are, how quickly we can flex. I know people are tired and staffing is an issue everywhere, including our hospital. But I'm satisfied with our capabilities.
Thank you. That is good to hear. I also heard quite a bit from our community this week, in particular folks in Eudora and Baldwin. I'm incredibly grateful to USD 497 for having a mask mandate for all of their students, because we know most of the folks in our K-12 schools don't have the ability to get vaccinated. But unfortunately, we don't have the same mask mandates in other school districts within our county. We did see Johnson County put a mandate in place specifically for kids because of this. Is that something that our public health experts have considered? And what are your thoughts when it comes to those spaces where we can't have full vaccine access because of age and we don't have mandates in place?
Well, I don't know that it's fair to say we're against a mandate, but what I would encourage us to do now, because I think there is some urgency around understanding how to enforce, how to assure compliance. What does it really mean when we have an order? We learned that on the fly a year ago, and then we had lots of legislation kind of change the ground underneath us around what are the tools for compliance. And so I think we need to continue to meet and meet regularly now to understand how do we create and how do we become ready to have an order that has true meaning.
And commissioners, if I can jump in here a little bit, I think the specific question was, how do the health officers feel about the ability about masking for young people? But I also, if you feel like we've got the answer there, I did want to have legal counsel talk a little bit about what we think the role could be with schools. Throughout this pandemic, even before Senate Bill 40, and now Douglas County has really viewed that we felt we had limited options with schools and universities to guide their behavior. Johnson County's action sort of challenged that assumption as to what counties are able to do with schools. And I think Brad could provide some additional context on that related to it. But I just think it's fair to say that there is we're talking about a lot of new case law. There's not a lot of base information. And it just depends on the level of comfort we have with those things from a legal perspective, not necessarily from a medical perspective.
Thanks. Brad Finkeldye, legal counsel for the health department. I would start by saying, very early in in COVID, there was the question of whether or not a health officer or a county could mandate masks in schools or shut down schools, right? Could they close a school? Could they say you can't operate? And the Attorney General came out with an opinion at that point that said, you know, constitutionally, school boards run their schools, school boards operate those schools, and you know, in his opinion, you know, a health order could not override that. You know, AG opinions are persuasive, but not binding. Most folks went along with that in the state, and there was very little action by counties across the state to implement early on, like closing schools, any of those things. Eventually, you know, some mask mandates started to come out, and there was a question of whether or not the mask mandates, you know, a county-wide mask mandate, does that apply to a school or not? And most places took well, if it's county-wide, it applies to us too. Most people just assume that. But then SB 40 came out, and SB 40 came out and it specifically said, under state law, a health order cannot override the school board. The school board has final say. Okay, we thought, okay, we all know the answer to the question now. Then SB 40 is held unconstitutional and is currently stayed. So what is the status of the law and whether or not we can, whether or not a county can enforce a mask order? You know, there's no clear answer on that. A couple things to note on that. One would be if, you know, the Attorney General has asked the Court of Appeals and the Supreme Court to reinstate SB 40 pending the appeal, lift the stay, let SB 40 go into effect. That's not happened yet, but anytime that it does happen, that answer would then be clear. Only a school board could do it. Don't know if it will, but put that out there. Second, I would say, you know, what Johnson County did, as you noted, they passed a mask mandate applying to schools. However, the enforcement provision of that health order says the local school board shall enforce this order. That's the enforcement mechanism, not a criminal mechanism, not the sheriff enforcing it. The school board shall enforce this order. And then when the Johnson County counselor was asked, do you have the power to do this? He said, well, we've done it. If a school board wants to opt out of it, we'll see what happens. Again, not an overriding confidence in the answer. So again, as with many things in the law, I can't tell you what the right answer is. Certainly, it could be passed. I think the question then would be, you know, would the school district have to follow it? And if they chose not to follow it, who would win that legal battle? Is somewhat unclear unless SB 40 comes back into being. But that's kind of the status of the law.
Thank you, Brad.
Mr. Commissioner Kelly, I have some questions for Dr. Marcelino or Dr. Scrimshire or Dan. You know, there's been a lot of discussion about youth, and earlier this year, we talked about young people who couldn't be vaccinated and the rates that we were seeing of COVID hospitalizations and cases. Can you give us a bit of an update? I know we want to protect our most vulnerable young people, but I'd be interested in how many cases we're seeing in young people or hospitalizations we're seeing in young people.
So sorry. I don't know what our numbers are. I can't recall. I mean, I know that the younger age groups represented a large percentage of our cases recently. I haven't seen any under 18 hospitalized. We did have a 22-year-old hospitalized recently. Oh, you can't hear me? Go on.
Oh, okay.
I can go ahead.
Testing, testing. Okay.
Sounds
We-
like all of the audio came back. So if Dr. Scrimshire wants to try again, that was on our end, Dr. Scrimshire, not yours.
Yeah, I think
Oh,
There you go. We can hear you.
all right. I was like, oh no, what did I do? What did you hear? Nothing?
Nothing.
Start from the top.
That was good. I don't know the numbers. I do know, I mean, I can't remember the exact numbers. I know that in looking at the countywide data recently, that the younger age groups have represented a large percentage of our new cases. I don't know that we've had anyone under 18 hospitalized. I apologize for my cat. We did have a 22-year-old hospitalized recently. But I know there's it seems like an increased number compared to previous, or percentage.
Yeah, I would echo that. And I think it's because what we're seeing is the rapid rise in cases, the so-called burn through. So as you see that rapid rise and kind of the rise in cases, you're going to see, really hitting the people that are unvaccinated, the people that aren't wearing masks, children. I think what's been really hard, I saw, the report from Children's Mercy, there's a huge number of patients hospitalized with RSV. So when you see these kids with these symptoms, in our clinics or in the community, it's really difficult with the RSV in the background of all of this to try to interpret these symptoms. And, testing is going to be huge. If you're sick, staying home. If your child has a cold, staying home. There's no doubt that masks are an important part of all of this. And, we have strongly recommended, and, we agree with the CDC that unvaccinated children should wear masks in school. And so, how do we get to that point? Obviously we've wanted school boards to come to that, in a voluntary type fashion and use common sense to approach the recommendations and follow the guidance. As far as what Johnson County did, I've looked at that and I think it's definitely an option to consider, and to apply it to K through 6 and hopefully it would achieve compliance. I think it's something to consider. I just want the kids to be safe and to have masks on and in that environment, and how to achieve that is the question.
Well, and I do appreciate you bringing that up, because we did see some behavioral change after Johnson County, because before their mandate, Blue Valley wasn't requiring masks. We did have some voluntary compliance after the mandate was in place.
So I just wanted to follow up on my question, because I heard about 18-year-olds and 22-year-olds. We don't have numbers of how many cases we have that are, 2 to 12 or hospitalizations for 2 to, we don't know that. Is that right?
I don't know if we can get Sonia Jordan on, and because she's going to be probably the only one who right here in the moment has that number in her head. But we can certainly get that to you tomorrow.
Okay.
Well, and just as a follow-up to that question, hospitalization is incredibly important. We want to make sure that our hospitals are ready, but sick kids are still terrible, even if they're not terrible to the point of being hospitalized. Do we have any tracking for, active cases and severity that doesn't require hospitalization? And the number of active cases in kids under 12, even if they're not hospitalized?
If I understood your question, no, there isn't really a tracking mechanism that will flag so-and-so went to their physician but did not go to a hospital. What we track is hospitalizations and then just positive cases. The acuity is not something that we've got the data to really report on.
But we do, Sarah, we do track it by age. So Dan, in addition, for those 2 categories, either confirmed positive and or hospitalization. So if that's something you could follow up with us tomorrow. I don't see Sonia on the attendee list. It would be great to have that information.
Yeah, absolutely. I understood the question to be more around what's the acuity kind of underneath hospitalization. So, but yeah, we got the age groups.
This is Dr. Scrimshire. I do know that Children says every time we're on a call with them, they have hit a new record of positive COVID patients, inpatients. It's still the last I knew they were, I think, in the teens. So it's not an insane number, but it's still the highest they've seen, which is important.
So on the Douglas County Health Department website, there's a graph that says past 14-day PCR test positivity rate. For age 0 through 9, it's 4.2% positivity. In age 10 through 17, it's 4.7% positivity. If you look at the breakdown of the actual numbers, we don't have that listed on there, but the positivity rate is listed for the age. The highest positivity rate is in the 45 to 54 age range right now for the past 14 days, but it's kind of spread across the board if you look at it.
So I'm wondering if this is Commissioner Reed here. I'm wondering if maybe this is a question best directed to Sarah or maybe the health department. I'm just curious about unified command and kind of the status of that, including what the conversation has been like with the various school districts. So since we're discussing the fact that different school districts have implemented different procedures or mandates or lack of mandates as their school years begin, I'm curious at unified command level or within the health department, what conversations and direct guidance has looked like for those school districts in recent days and weeks, especially.
Go ahead, Dan.
I'll just be brief and then let you finish up, Sarah. So Unified Command has an education group underneath the structure, and so they meet regularly. They met today, and so there is regular direct communication through Zoom, and I'll let Sarah take it from here. And thank you, Dr. Marcelino, for pointing me to our own website. I do have those numbers if you want to loop back to that.
You can go ahead and give those, Dan, I guess. Yeah.
Okay, sorry for the 0 to 9, we have 361 cases, 10 to 17, 632, 18 to 24, 3,211, 25 to 34, 1,649, 35 to 44, 1,271, 45 to 54, 1,081, 55 to 64, 915, 65 to 74, 575, 75 to 84, 251, and 85 and above, 218.
And I have a question about those positivity tests or positivity rates. Dr. Marcelino, you mentioned it's just PCR tests. Can you help me understand why PCR tests and not other types of tests and how we differentiate between those things?
Yeah, I'm not sure why we're on our website. We're just referring to PCR tests, but the PCR is the better test, the more reliable test. If you're doing a non-PCR test, it's really only helpful if it's positive. If you do a rapid test that's not a PCR test and it's negative, then you want to really back that up with a PCR test. So the PCR is the gold standard test. So that's why we choose that to follow the data with. It's the most reliable test that we have.
So do people typically, I hear what you're saying, that the PCR is the most reliable and we want to use that for our data and reporting, but do people typically get an antigen test or a rapid test and then also get a PCR test, or could just using that one form of testing in our numbers mean that we're underrepresenting numbers in any way?
I guess I would add that we've used we've used this testing protocol since the beginning of COVID, that was the more reliable testing method. So I think that if there are some folks that get a positive rapid test, they may go ahead and get a positive, they may take a PCR test. And basically, I think we're using it for confirmation. So if you get a rapid test, you should probably do a PCR test to confirm. And I believe that this is the guidance that the state has set forward to us in terms of the tests that we should be tracking so that we have consistent data to the rest of the state. And Dan and any of the doctors, correct me if I'm wrong there.
Well, what I'd add to that, and is we rely upon kind of state databases and reporting requirements through the lab surveillance system. So in part, the reason we report what we report is because the system is set up to collect that test and that information.
This is Scripture. In general, I mean, we also don't include those that are diagnosed by symptomatic. Like if you come to me with symptoms and you've had an exposure, I may not even do a test. I'll just say, yeah, you're positive, go home and isolate. So, I mean, and then how many people just don't ever get tested? So we underestimate the numbers. I mean, probably maybe 4 or 5-fold, just in general.
But we've been consistently underestimating throughout the pandemic is what I'm hearing. Okay.
Back to the question about Education Unified Command. We did have an Education Unified Command branch meeting today. On that call, I was on that call and I had some conversations with the Eudora district. The Perry Lecompton district was on that call. And then I also had some conversations with superintendent in Baldwin City today. What I would say from my conversations with them over the last couple of days is that this is a really tough issue. I think their school boards have really wrestled with it. There are a lot of folks that feel strongly on both sides of an issue. And I think, local school board officials are really struggling with, how effective a mandate might be. What are the consequences of enforcement of that, of non-compliance, particularly in a school environment where you want children to still have access to learning. And I think that is if I can speak for them, which I am reluctant to do so, those are the kinds of things I heard. I do think that there is, those votes by those districts have been close. And I think they're still looking and considering those. I think they did see what happened in Johnson County and that made a shift. I think that how that impacted that community, whether or not how that would impact this community is a separate question. But if, I think they all of the bodies are trying to be thoughtful and really consider what's best, but it's a really tough issue for them. I do want to add, that conversation was really around K through 6. At the middle school and high school level, I do have information on how they're quarantining and testing protocols and how they're really trying to advance vaccination. And, if you are vaccinated and you have an exposure and you test negative, you can still continue to come to school. You can still continue to play sports. So I think there are a number of different measures in place at the middle school and high school level that those communities are really working very similarly to what exposures might look like in USD 497. But at the elementary level, it's, there's less of those activities and then obviously there's no vaccination.
And if I could add to that, around no vaccination, again, back to the panel conversation last night, vaccines for that younger age group, we believe will come out this fall. And, I think what we need to do now is continue to message efficacy and safety so that when the vaccine does become available in over the coming few months, that kids and parents choose to get vaccinated.
This is Dr. Merson. I appreciate, Sarah, the background on all of that with kind of your thoughts on the school board and things. And I think as a doctor, we try to follow the science and make the recommendations that we think are going to help the community. And when it comes to, implementation, that's where I think I'm struggling with, telling school boards or schools exactly what to do at this stage in the pandemic, because I believe that the school board and educators are really best at determining what's best for their districts and their students. So we give the recommendations, and then the implementation, I think, is best served by each district. And so that's a little background on why maybe I'm not just saying we need a mandate right this minute for similar to what JCO did, and just trying to understand more about what the school boards know about their districts, what they have about each individual school and their policies and guidance for COVID. And of course we want masking. That's what is going to be the best. How do we get there in this new environment with the pandemic, as it's evolved, is the question.
I appreciate that. And I do think that that's where we have some of the health sciences and what we know as far as how diseases are transmitted, but then we also need to rely on our behavioral health scholars and making sure that we can think about that implementation side. And what we saw from kind of the last round of this is that communities that had mask mandates had less spread. And even when we look at an enforcement perspective, communities that had mask mandates but didn't have rigorous enforcement still had less spread. And so there is a lot of evidence that mandates work. And so when we think through kind of the science side of it, we have to think about health sciences, but also the really hard sciences, which are the social sciences, and how do people function. And so that's where I'm wondering, what is the best thing for us to do for our community, and what are our obligations as community leaders to say, if this is what we know from kind of the health side, what is the best choice for us from a policy side of things?
I have a question for Brad. That's okay. I didn't know if any other commissioners had questions. Brad, are you familiar with any county that has ever applied authority on a school district in Kansas? I mean, I'm not asking for an exhaustive. I'm just trying to think. I'm trying to think if there's it seems like Johnson County is pretty groundbreaking. I've never really heard of a school district being, other than like if it was a countywide mandate, that would be something. I guess, is my question clear?
Yes, that's the first that we've seen of that. First we've seen of that anywhere in the state that I know of, and I try to keep up on these things. So that's the first I've seen of it. I will say again that their enforcement mechanism is this shall be enforced by the school district. So if the order is you shall wear masks and you shall enforce it, in theory, I believe Spring Hill has said, basically, I think it's Spring Hill, if I'm wrong about that, I think Spring Hill has said we're not going to enforce it. And so again, technically, are they violating the health order that says they're supposed to enforce it? It's kind of a tricky question. But no, it's again, constitutionally and otherwise, you would typically assume that the school board has complete control over the operation of those schools.
And that would include anything else like curriculum or hiring a superintendent or any of the other functions of a school board. I don't think I've ever heard of a county in Kansas. I know in other states there's different rules, but I just don't think I've heard of that, and just wanted to confirm that you hadn't heard of that either.
I have not.
Okay, thanks.
So I think that is an important line of questioning, because typically it's counties who have responsibility for public health within their communities. So school boards, when we talk about the kind of the constitutional obligations of the school board, that typically does focus on things like curriculum and how they're monitoring safety within their schools, but broader public health tends to be the expectation is that the county sets those. There was a question mark at the end, Brad. It's mostly just how are we dividing the areas of the law?
Well, yeah, I mean, I was trying to think, and Dan might be able to help me, maybe in a context other than COVID, which is the only time I've really dug into this per se. I mean, if there was some sort of rotavirus outbreak at the school or a food poisoning sort of situation. I mean, I'm not sure if there's a situation where health department would step in and close a school. Again, I can't think of a situation where the school board would object, but Dan, you might be able to help me if there's that type of situation.
Well, I think, what is a public health authority that does extend into schools, but COVID's kind of clouded it, is isolation and quarantine. I believe, unless I'm not keeping up with the law, we still have that ability to say this student must not be in school.
Yeah, that's an individual, that's a power over an individual under a state statute to no matter where they're at. So yeah, that's not really controlling I wouldn't put that in the same category, because that is the ability over one person, one at a time, and they each have the right to individually go to district court and challenge that. So I wouldn't put that in the same category.
What about inspection of school kitchens and food safety?
So the Kansas Department of Agriculture does do food safety kitchen inspections. And there is compliance required on that. And the statutes from way back in 1885 also say that every county health officer shall inspect each school annually. And so we conduct those at the health department under the name of Dr. Marcelino. And what that really is a safety inspection, looking for hazards and things that need repaired and maintained. And we have never had a school district object to fixing something that was a safety hazard. So we've never had to test what it means to try to enforce that authority. So that's out there also.
Dan, for influenza, is it up to the school board or school officials to say when we get to X number, we close down, or is that the health department?
I believe it's the school district. I mean, they get to decide, well, I've only got 10% of my students, so we should just shut down. But I would say we've never had that experience, never tested that assumption.
Again, lots of interesting legal aspects. The one I know some of us have dealt with is, technically schools do not have to comply with city building codes. They apply with state building codes. Now, they might voluntarily choose to follow city building codes, but they don't have to. Another example of, again, kind of the state level authority over schools as opposed to city or county. Again, as a separate constitutional entity, they're a little different because they do have certain powers. So again, Commissioner Portillo, to your point, it's not a clear answer. Not a clear answer on going either way on that. And so I do think if we wanted to go that route, I think the Johnson County route, is a particularly clever, I'm not sure if that's the word I want to use, but a particularly innovative route, which is it's a mandate, but each school board is charged with enforcing it. And that gets us back to a question we have always struggled with in COVID, is how do you enforce a mask mandate? Do you send the sheriff out? Do you send a Lawrence PD officer, into a bar in earlier situations? Is the health department the one doing it? So that's an interesting method of which Johnson County uses an enforcement mechanism.
Do we have additional questions from commissioners? Are we ready to open this up for public comment? Okay, we will open up for public comment. Do we have anyone here in the courthouse with us for public comment on this item? Please come forward. I will just remind folks that all public comment needs to be kept to 3 minutes or under. Please state your name and your address before starting your public comment.
Hi there. My name is Martin Murphy. I live in Lawrence. Can we ask questions?
Can we?
I'd like to ask Dr. Salino a question. Marcelino. Okay, but
You
I
can
hear
put
a
your
lot of
questions on the
information.
table and then they will answer them when we're done with
fine.
all of public comment.
Okay, so if the PCR test is the gold standard in testing, why is it the FDA and the CDC have said they're discontinuing the PCR testing because it's unreliable? Also, the inventor of the PCR test has said that the test was never designed for COVID, nor was it designed to be testing at cycles of like 40 and above 35. And as far as I know, and as far as lots of the people I read about and hear about, the virus has never been isolated. So the PCR test has been geared with COVID. And so testing everybody has had the flu because COVID is a coronavirus. So everybody's had the flu. So everybody's going to test. If you're cycling it out at 40 and above, everybody's going to have had the flu and have antibodies of the flu at some point or another. Has anybody thought about looking at Sweden? Sweden doesn't have a mask mandate. Sweden didn't have a social distance program, and Sweden has the lowest cases in Europe. And I know Sweden's not in Europe. Also, you guys showed graphs earlier of the United Kingdom and India and the variant and the drop off in India. Do you know why it dropped off in India? Because they started administering ivermectin and hydroxychloroquine. And that's why it dropped off. What is the standard for testing for variants? If the gold standard for COVID is a PCR test, is there another test for variants? How do we know if it's a variant? How do we know it's a Delta variant? It's an English variant, right? These are real questions. I hear everybody asking questions here, and all I really hear from Mr. Partridge up there is we need to mandate vaccines for a virus that's 99.9% recoverable. Vaccines. Wasn't there herd immunity? But now that the WHO has changed what the definition of herd immunity is in this virus, in this pandemic. You guys are the professionals in health, and I'm having to tell you this information. And if you don't know this information, then shame on you. The information's out there. You know about the American frontline doctors. You know about the studies in Spain and the use of hydroxychloroquine. And all we're talking about, and the commissioners here, is talking about how can we mandate and how can we get our kids to wear masks in school and how can we force them to wear it and do it? Come on, people. We have a virus that's 99.9% recoverable in our age group, everybody in this courtroom. And we're all talking about we should be taking a vaccine. Think, please. I'm not up here lecturing you, but I'm up here to there's other information out there. The information from the CDC is one day masks don't work, next day wear 2. Okay, next day wear 2 masks. It's ridiculous. Thank you.
Do we have anyone else in the courthouse for public comment?
Hello, I'm Virginia Merritt of Baldwin City. As a parent and aunt of the students enrolled at Baldwin City School District, I'm asking the Board of Commissioners to help in stepping in a proactive as opposed to a reactive approach in keeping our schools open and functioning to their best ability this year and establishing a mask mandate for our schools. I'm hopeful you will be able to step in similar to how Johnson County Board of Commissioners did in an order that requires masking in schools. Our school board meeting in Baldwin school board meetings in Baldwin have been difficult as of late. Our board has been threatened with legal action and disenrollment from parents and who are reluctant to mask. Several of our teachers and staff feel uncomfortable speaking up with how polarizing and aggressive these meetings have become. There seems to be a reluctance at the board level to follow health department guidelines and recommendations, even at the local level, and a desire to create their own guidelines as the year progresses. Eudora has one of the highest positivity rates within the county, and our schools will soon be participating in activities together. Both districts have mask optional policies. Our next school board meeting is set to take place the day before school starts. And many mask optional many events are taking place with families included, mask optional. I'm hopeful our board will be able to come around and make a responsible choice, but I'm unsure. Our superintendent did make mention at the last meeting of our county not yet mandating masks at the county level, and we did have several board members at the last meeting leaning towards mask mandates. Our very recent vote on COVID protocols, which you should have a copy of, are confusing for families and staff. I'm fearful it introduces a mask mandate when it's likely too late. We've had a lot of opposition in our community regarding testing, confusion as to what point our child can return to school after a fever. I'm fearful of the dynamic it's going to create as school starts. Baldwin is a commuter community and with a university, but it's not uncommon to be harassed at our local grocery stores for wearing a mask. Our smaller cities have lower vaccination rates, and after listening to Chief Medical Officer at KU Med, concerns of COVID reinfection and needing our vaccination rates to be higher because of the Delta variant, I'm even more concerned with that lower rate. I don't believe I have to go into all my concerns and list aside from protecting our children in our community. I have additional concerns regarding bullying, increased anxiety, and mental health effects on our children, as well as additional risks for our neurodiverse children who already have to deal with impulsivity and forgetfulness and keeping masks on. With everyone being masked, it reduces their risk. I am asking commissioners for their help in giving our students more security and to enact a mask mandate for our schools, allowing our children the opportunity to have the best school year possible with circumstances with as little disruption.
Thank you. You
And
have
taking
3
this
minutes.
conservative approach. Thank you.
Do we have anyone else here in the courthouse for public comment? And we will get to public comment from those of you joining us online as soon as we're done with public comment from folks in the courthouse.
My name is Cole Carter. I'm a Douglas County resident. I just heard some numbers and a lot of data that kind of confused me. I heard that there's 15 hospital beds full with people that have COVID right now. And there are numbers being thrown around in the estimate of 650 active COVID cases. I also heard them say that's probably 2 or 3 times as many people that actually have the virus. Now, if that's true, if it's 15 out of 650, that's 2% of the cases are being hospitalized right now. If it's 2 or 3-fold that, then it's either 1% or 0.5%. So I'm just wondering, how serious is this in our community right now to be throwing around words like authority, order, mandate from data that's been collected from other places in the globe? How reliable is that data? I just think based on what was shared too, 2 of the 15 cases are unvaccinated people, which means 13 of the 15 are vaccinated. Now, I have the understanding that somewhere between 50 and 60% of Douglas County residents are vaccinated. If we apply that to the amount of people that are in the hospital, shouldn't it be at least half of the people in the hospital that are unvaccinated if we're following based on what the census is for who is vaccinated in our county? That just doesn't add up to me. It doesn't make sense. And if anything, I'm interpreting it that, is it not possible that these vaccines aren't as effective as we're discussing they might be? They could be effective. I'm not ruling that out at all. I just think it's interesting. We're not talking about any other kinds of solutions other than masks, other than vaccines. I mean, what about biological health, psychological health, social health? How many comorbidities do these people in the hospital have? How are we addressing these? There's just a lot going on here that seems like it's being completely ignored in the face of the potential to make rules and orders that are unprecedented. And I'm just wondering, is that valid based on what's actually occurring? So these are just questions I've had. Thank you.
As we're waiting for the next person to come forward for public comment, I do just want to point out that those numbers were reversed. It's the smaller number is the number of vaccinated folks in the hospital. The larger number is the number of unvaccinated folks in the hospital. So those are just flipped. Do we have anyone else in the courthouse for public comment?
Hi, and you want my address too, right? Okay, my name is Jessica McQuarrie and I live at 108 Elm Street in Baldwin City. I come here as a parent of 2 elementary aged children in Southern Douglas County, and I'm worried about this coming school year with COVID-19 precautions. You see, on Monday night, the Baldwin School Board voted on a plan that eliminates nearly all of our COVID prevention measures. And while I do truly sympathize with the exceptionally difficult position our board is in, trying to mollify 2 vastly different sides, I fear that they're simply removing too many protections at once. We already limit our ability to distance to 3 feet by bringing everyone back in person. Then the COVID plan approved on Monday increases our potential transmission points by also eliminating our classroom cohorts and our AB scheduling. Lastly, by abandoning universal masking, we eliminate that final layer of protection that becomes so crucial when the other protections aren't in place. Now, many of the Baldwin residents have we've done everything that we're supposed to do. We have listened to the county, the CDC, we've taken scientific guidance to heart. However, I have been saddened to see how many others interpret these recommendations and guidance. Instead of focusing on the greater good to protect the public health and safety, many people are choosing to exercise their freedom to not wear a mask instead of following science. We've come too far these last 17 months to throw caution to the wind as we face the Delta variant. As we've discussed, the KC area hospitals are already at their tipping point, and many of them are juggling patients to be able to handle incoming cases. KU Med has had to refuse transfers recently. This is all happening before we've even started school or entered the cold and flu season. The American Academy of Pediatrics released data for last week and reported that nearly 94,000 child cases occurred last week, and that was accounting for 15% of all new cases across the United States. And I think we can attribute that largely to Delta. In the past few weeks, we've learned a lot about the Delta variant. We know it's more transmissible than Ebola or smallpox. We know that the original COVID had an R0 factor or a replication rate of about 1.5 to 2.5. And that meant that each case would infect 1.5 to 2.5 other people. This Delta R0 is estimated to be between 5 and 8. And we know it's sickening children at higher rates than the original. We're not an isolated community in Baldwin City. We buy groceries here in Lawrence. We work in Kansas City. We play sports in Eudora. We go to DeSoto. And I just think it doesn't make sense to exclude our children when they've sacrificed so much for us in the last year.
You are at 3 minutes.
Thank you.
Do we have any other comments in the courthouse? Okay, we will go to online public comment. I see that we have a few hands raised.
I'll move over Donna Ginther first. Donna, go ahead. You're now on the panel.
Donna,
you'll
you're
need to
muted.
unmute yourself.
Hello, this is Donna Ginther. I'm a professor of Economics, and I direct the Institute for Policy and Social Research at the University of Kansas. We did a study that was published in June on mask mandates and the impact on COVID cases, hospitalizations, and deaths. And I want to point out an important nuance of that study. Now, when the governor put her mask mandate in a year ago, 3 counties decided to comply with the mandate but not enforce it. That was Crawford was among them, Mitchell, and I can't remember the third. But those counties that did not enforce the mask mandate had the same level of COVID case reductions as counties that did enforce the mask mandate. So the mandate is what works, not necessarily the enforcement. And I think that everybody in public health needs to keep that in mind. The second thing I want to point out is that I looked at the KDHE numbers for Douglas County, and the KDHE numbers suggest that we have a 6% positivity rate compared to the 4% that was reported today. Third, if you look at the wastewater, the amount of COVID virus in the wastewater, I was speaking with Belinda Sturm at KU earlier today, and she said, and Justin Hutchinson, who are monitoring these numbers, and they said that the amount of virus is at the highest level it's been since we hit our peak in February. Now, keep in mind that this is before the students from KU come back, many of whom are not vaccinated, at least a third to a half. So we're going to get 10,000 more students here who are not vaccinated circulating in our community, and before K through 12 schools open up to full in-person learning. So any of the data that Dr. Scrimsher showed earlier that Tammy Gurley puts together at KU Med does not include information on K through 12 or child cases. So as a result, those estimates of forecasting the number of cases are going to be biased downwards. So I think that the public health officials in the city need to keep those 3 issues in mind. First, being that it's the mask mandate, not the enforcement that matters. Second, that we're underreporting the positivity rate, most likely. Third, that we have a lot of COVID already, and we haven't even introduced the KU student body to the community. So I hope, my perspective would be that a mask mandate for the entire county is warranted, given the amount of COVID we have already, and the fact that we're going to have a shock of new people potentially bearing more virus in the future. Thank you.
I'm going to move Ward Lyles into the panel next. Ward, go ahead.
Thank you. Ward Lyles, 812 Indiana, Lawrence Street, in Lawrence. I'm an associate professor in the School of Public Affairs and Administration, spoke earlier as and pertains to the land use issues. As a professor who studies policy and mandates around land use, I do that mainly in the realm of disasters. So the transference here to COVID. Mandates work. I will echo what Dr. Ginther just said. Her study was published, if I'm not mistaken, in the Journal of the American Medical Association, not something that often happens by economists. So it's really robust. The mechanisms by which, as Dr. Marcelino indicated, being a physician, I'm not a physician, but I am a social and behavioral scientist. Our expertise would say the mandate works. Part of the mechanism is that people who might think that it's okay to go without a mask because they're not being told by officials to go with a mask will begin to do so. And then there's social norms, right? We are lived in a network society. And if I see more people wearing masks, then it catches and picks up momentum. KU and USD 497, great that they have masks, as we're hearing from families who are concerned in Baldwin City and Eudora. There's also the concern, we have the 15,000 unvaccinated people that are ineligible for vaccines in our community, the 30,000 roughly who've chosen not to, but these 10,000 who are coming into KU, they're coming in and KU is sending every message that they're going to get back to normal. And for those students, that means off-campus gatherings in big groups. We saw it last year, even when we had health orders, and they just did not pay attention. I will just kind of beg, beseech, whatever I can do. We have everybody, at least when I talk to them offline, will say that we are headed toward a train wreck. We are headed toward a train wreck right now. Long COVID is happening in kids. I've been to the ER with a kid. They were not admitted, but it sucks. Nobody needs to be going through that. What we need to do, and you all are frankly right now our only hope to get ahead of this. KU students will be back in earnest starting Friday to come back to start rush for sororities and fraternities, moving into dorms. Next Thursday, at least in Lawrence, kids are going back into schools unvaccinated. We may be able to mask them while they're in classrooms at KU or USD 497, but there's so many other settings. At the very least, I would say, please do a mask mandate for restaurant and bars for people who are not seated. At least for the Hawk and the Bull and the Wheel and some of our big problem places, that at least begins to give us some ability to hold people more accountable. It's not, unfortunately, because of the state and the national context, the reason that we're still in the problem with Delta is because we didn't listen to social and behavioral scientists who told us that the millions of actions that we have to regulate every day and encourage people to engage in pro-social behavior are not being done. The medical science is not enough. We need to pay attention to social and behavioral science. And that means, please believe us when we say we study mandates and they work, even if you don't go around and beat people over the head with the consequences.
And you are at 3 minutes.
Thank you for your time and attention.
I'm going to move Shalene Bass into the panel next. Shalene, go ahead.
There we go. Hi guys. I don't know if you can see my video, but if not, hold on. There we go. All right. Hi guys. My name is Shalene. I live in Baldwin. I'm also a member of the Special Education Department at the University of Kansas, focused on low incidence disabilities. I'm going to piggyback on a little bit of what you've already said. Unfortunately, here in Baldwin, our school board is struggling. I'll just cut right to it. They're being bullied. They're being threatened. There's a lot of anti-maskers and pretty popular prominent families in the small town of Baldwin. So basically, I'm asking for your help. I feel like if there was a mandate and the decision came from someone other than the school board, it would be such a relief to the board. You know, if the board votes for masks right now, all heck is going to break loose in Baldwin against them. If somebody above them can come in and say, hey, masks, then the pressure's off of them. I hope that kind of makes sense what I'm trying to say. It's just the way the world works in a small town. You know, if your name is a certain last name, et cetera, et cetera. So please, I'm just really adamant about the mandate. I think it will help. I think the board will enforce it. I don't think there'll be an issue with that. They're scared, they're being bullied, etc. Also, you know, I have a young daughter, she has leukemia. We work with Children's Mercy and her oncology team for years now. And she's supposed to, you know, work so hard and fought her leukemia for 2 years and she's in active maintenance treatment and she should be starting kindergarten. And I'm so terrified when they find out that Baldwin does not have masks, that they're going to say she can't go to school. And I know I'm not the only parent that maybe has a child with needs like this. And her oncology team at Children's Mercy is going to say, it's not safe for her to go. And that is just, it's just heart-wrenching, you know, when we've done this and we've fought and we've talked to children. And something else children has told us, better hope Easton doesn't get a fever, because an oncology patient, if you get a fever, you're automatically admitted. Well, guess what? There's not a bed for her, whether or not she has COVID or not. There's not a place for these kids. So if there's something we can do to stay out of the red, to rock the yellow, if that's what we need to do, please issue the mandate. I know I'm kind of talking fast, so I'm trying to get in, but I just want you guys to know, like, you know, it affects everybody and not just maybe regular healthy kids, but kids that have been fighting and really want to get to go to school. And I want to see her in her first day of kindergarten. If put on a mask and get her there, please, let's put a mask mandate in Baldwin. Thank you guys.
I'm going to move Vincent Francisco into the panel next. Go ahead, Vince.
Thank you. Thank you for the opportunity to speak this evening.
Name is Vincent Francisco. I live at 1713 Louisiana Street here in Lawrence, Kansas. I want to reinforce the points that Dr. Ginther and Dr. Lyle were putting forward. There are quite a few more of us on the KU campus as behavioral scientists, as social scientists, that we've not only got data and quite a bit that we've been working on over the past year and a half to help demonstrate the influence of behavioral science on being able to facilitate behavior change at a broader community level, but that we can do a lot more to help support the work that our public health colleagues are doing. I want to make sure that we recognize, that I want to recognize our public health colleagues that are on the panel this evening. Y'all put in way too many hours and are so committed to this that your work is really recognized and it's understood. I'd love to advocate for adding behavioral science into the mix and to advocate for the mask mandate. You already heard the testimony. The data are real, and look forward to being of service should that be helpful in the future. Thank you all so much.
I'm going to move Ivana's Chen into the panel next. Go ahead, Ms. Chen.
Thank you for this opportunity to share my thoughts in front of our panelists as well as our commissioners. My name is Yvonne Chen. I am a Lawrence Douglas County resident. I'm also an associate professor in the School of Journalism and Mass Communication, studying health communications and ways to better communicate with people in health campaigns. I want to support all of the panelists' scientific data, as well as the school teachers from Baldwin School Districts, as well as my colleagues, Dr. Ward, Dr. Ginther, and Dr. Francisco, who share about the importance of mask mandate. We all know that policy works. At the same time, I feel like this also presents our health department and the school district an opportunity to also consider ways to message around this policy. And think about it. Usually when people hear about mandate, they may be tired of it. They may want to feel rebellious. But at the same time, I think hearing the Baldwin School District teachers' concerns and also parents and aunts' concerns, there are ways we can soften these type of languages around the public health messaging in terms of sharing the feelings, expressing our compassion. And as Dr. Francisco mentioned, public health workers have been at the front line. You all have been pulled all-nighters for a very long time. And I think our local residents are also ready to hear a more compassionate messages surrounding why are we putting mask mandate right now? Is because we know train wreck is something we don't want your children to go through, because we don't want this to happen to our children too. So thank you so much for listening. And I hope that you will seriously consider mask mandate.
That looks like all of the public comment.
Okay, then we will bring it back to commissioners to discuss. I will say that I am deeply appreciative of, well, before we get to discussions, we did have some questions that were posed during part of our public comment. And so I want to give Dr. Scrimshire or Dr. Marcelino the opportunity to respond to any of that you would like to respond to.
The one thing that stood out to me was somebody had a question about if your child has a fever, there's a lot of confusion in the community about when they can go back to school. They have to meet several criteria. Really, you have to be 10 days out from your initial symptoms. You have to be fever-free, and you have to be fever-free for 24 hours without medication, and you have to be symptom-free. So there's a series of criteria that you have to meet. And if you ever have any doubts about whether or not you should send your child back to school, always check with your physician or reach out to the provider or health department.
I don't remember the exact questions from the first speaker, Mr. Murphy. I wrote down the points to address. PCR being the gold standard, it is this time. Typically, historically we said viral culture was a gold standard, but PCR is actually more sensitive and specific than culture. The CDC did not say it was unreliable. The initial test that the CDC developed had issues, and they removed that. They redeveloped that promptly. The CT values not being meant for COVID. I mean, the CT values, I mean, think of anything else. We don't use CT values at all because we don't, it's not a normalized measurement. It is specific to each instrument or test. So, you know, when we do, like for HIV, we get a viral load. I know X number of copies of virus per milliliter of blood. That's how I get it. So yeah, CT values got into the public eye somehow and are now a thing. Nobody's isolated the virus. I don't know that that's true because I know that there are studies that look at not only PCR, but whether or not there's viable virus there. How do we know it's not the flu because of antibodies? I don't know that I really understood that. There are not the same genomic sequences in influenza and COVID, and we don't only use one sequence. There are multiple targets in these PCR tests. So it's not the flu. The numbers didn't decrease in India because of hydroxychloroquine or ivermectin, because those were used indiscriminately throughout the pandemic or throughout the surge in India. I'm guessing their numbers dropped because they rapidly reached some level of herd immunity, either through deaths or being immune. PCR does work. So, and we know there are variants because these are sequenced at the state level. They do whole genome sequence. They don't just pick out targets. They have not accepted SNPs or SNP or single genes as indication of variants. That's why it takes a while to get your results back, because we're not just looking at one gene. If the WHO changed the definition of herd immunity, it's because every variant, every time you change the R naught, you change the level at which herd immunity will be effective. So I hadn't heard about that, but I don't think there is any one level of herd immunity that works across the board for this virus. If 99.99% of people recover from the virus, why mandate? 20% of people get hospitalized. I think it's 2% die. 10% have long-term symptoms, long hauler symptoms. I don't call that 99.99% recoverable. I think that's a burden to our healthcare system in the short term and the long term.
Thank you. I really appreciate all of the public comment, and I really appreciate all of the discussion with our public health folks as well as our county council this evening. It's been incredibly helpful. I would like to see our community move towards what Johnson County has done with a mandate. I know that we may not be prepared to do that now because we don't have anything written up, but I am wondering if my fellow commissioners would feel similarly, and if so, what would be the next steps for us to move in that direction?
Commissioner Reed, I would agree. I'm in the same place with it. So I have questions about kind of next steps and mechanisms for that possibility of a mandate related to schools in particular. And then I also am curious, just because I know that a couple boards of education, also some county commissions have held special meetings. And so I'm just curious from a process standpoint, if staff can help us understand what would calling a special meeting look like. And I ask that specifically because I do have concerns about the numbers rising and how close and quickly approaching we are to the red zone as our current standards are. So I'm just I'm thinking about that and wanting to know what our kind of process options are in the coming days and week.
So I like the idea of a special meeting with those boards of education. I am a little worried about targeting specifically schools. I see kids all over the community. You know, when we first when we were working away from a mask mandate, I asked about a mask mandate for young people for this very reason, because I think that is within our purview. I get a little nervous about going into a specific school, and as I was listening to the KU professors, I started to wonder, like, if we know that our college students are the least vaccinated, should we also be doing a mask mandate for the University of Kansas? And then we start to pick different spaces where we think this is where we need to do a mandate. And so I'm wrestling with that a little bit. How we pick schools specifically. I think it would be good to have a special meeting with those boards of education to really understand if it's bullying, if we heard from one folks, but I just would like to have more information on that.
Well, and I just want to clarify, I think some of the special meeting conversation was a special meeting of our commission to see how we move forward, not necessarily a special meeting with the school boards. I would be open to both, but I think that and Commissioner Reed, not to put words in your mouth, but what I heard is what are our processes to put something in place. I will just say that KU does have a mask mandate, so that is kind of a good thing moving forward. I wonder if our concern is about space. Like, do we say, and this is different than what Johnson County did, so this may be an area where we need Brad's input, that we have a mask mandate for folks who are too young to be vaccinated in public spaces, including schools. So not just making it a targeted school piece, but saying that we're expecting school districts to enforce in schools, but we have a mask mandate for people who aren't vaccinated.
Can I ask commissioners how they feel about private schools? I mean, I think we're only talking about public schools. Have we had any thoughts on private schools?
The Johnson County mandate includes private schools.
Okay.
And I would like to include private schools as well.
How about daycares?
I think that I heard from constituents today that they are concerned that their kids are in childcare centers where a mother of a 3-year-old who was very upset that there weren't masks being worn. So I do think that childcare centers for children over the age of 2, which is what CDC recommendations are, as well as our public health recommendations, that it would make sense to include childcare as well.
Yeah, I'm just trying to give some breadth for our public health officials on where we are. And I guess I would be more comfortable if we included all spaces that young people 2 to 12 are in. That makes more sense to me. So sports facilities, you name it, if students or young people 2 to 12 are indoors. If we're going to go there, I want to sort of go all the way. I don't want to just choose schools.
I am good with that.
Yeah, this is Commissioner Reed, and I really appreciate that idea, Commissioner Cully. I think that that makes sense. I certainly had thought about private schools in addition to public schools, but not necessarily all the different public spaces. So I appreciate that. I'd be curious to hear Brad's input about that.
Maybe I could answer a process question and talk about that bit, and then we could talk about the legal issues. And this is just a recommendation, so you can decide if you don't like it. My recommendation would be that we let the public health team and the health officers go back and reflect upon the conversation that tonight and the information shared and the direction from the commission, and so that have their conversation determine if they're supportive of that recommendation, and that the health order, any potential health order, come from them having as a draft, as a recommendation, and after having been reviewed by legal counsel and put together in that manner, and then have it brought back to us. we can call a special meeting with 24 hours notice. But I would want to give some time for these folks to have a chance to talk and reflect and review the numbers and the data before we would immediately call another meeting. I don't want to speak for the doctors and Dan about how quickly they feel they could come back with some sort of recommendation. Our agenda timeline, we meet every week. It's pretty quick. So, ideally, if there was something for next week, we would have information, in our agenda packet by the end of the week, which is really just 2 days away. If that's not fast enough, I would also, in some of my conversations from logistics perspective with superintendents, doing this overnight is problematic. They have a lot going on right now. School's getting ready to get started. Things are happening. So while I understand people coming back into an environment potentially maskless is also problematic, I don't want to compound that by adding more confusion and not giving folks time to do this, if that makes some sense. And those are just my thoughts, and we can talk more about, like, from Brad's perspective in terms of what he thinks possible, or if the commissioners have questions about the process.
Sarah, I appreciate that. This is Commissioner Reed, and just to be clear, my question was about just the county commission and kind of what our procedures around special meetings are, because it hasn't come up in Minor Commissioner Portillo's tenure yet. And so wanting to know the mechanism for that, and not even necessarily specific to schools or ages, but if the numbers continue to escalate, knowing sort of what the mechanism for public health officers to how quickly they can come to us if that grows of significant concern. And Commissioner Kelly, to your notion of special meeting with school boards, I'm also open to that. I don't know if it's logistically very feasible. And I know that Eudora's regularly scheduled school board meeting is tomorrow. Baldwin's will be Monday. School will be in session for each of those districts respectively the next day. And so I do want to take this opportunity to implore those school boards to consider the harm reduction strategies that are available. And I really do see it sort of as plain and simple as that, for as divisive of a conversation as it has been for so many communities, that it is an effective harm reduction strategy. Is the 2 to 12-year-olds, the grade school age students in particular, are the most vulnerable population, purely because they are not eligible for vaccinations yet. And so it is a duty of, I believe, all institutions to do whatever possible to mitigate those risk factors. And to the point of bullying, which was kind of mentioned, but not necessarily talked about too deeply, I have a lot of concern about masks being an option for students, the environment that creates for a new layer of bullying and judgment between students, and that a mandate and community-wide following of that within a school community will contribute a lot to both physical health and safety, as well as social and emotional health and safety.
So I know our focus has been on kids. I do just want to bring up the question around, we also have a number of college students who are coming, and they will be wearing masks in the classroom. I am concerned about bars and restaurants and other social spaces. Is that something that we just leave until we hit that red area? Do we want to talk about a mandate for wearing a mask when you're not seated at a table in a bar or a restaurant, in other spaces? Is that beyond where we're comfortable today?
Because the vaccine is available to those students, and as the doctor said, those students have access to the vaccine. And maybe it's just my experience with our past mask mandates. I'm not as interested in exploring that, but I would, you know, if we get to those numbers, I think that public health officials have given us some criteria where we would get to that. And I'm comfortable with that.
This is Brad. Let me throw out a few thoughts from a legal point of view, kind of going with that last discussion backwards. You know, one issue we have to consider in any of the health orders is the equal protection argument that we are treating like-kind people the same. And, you know, so certainly if you did a 2 to 12 because they're unable to be vaccinated and you're treating that group differently because they're unable to be vaccinated, you have basically a valid reason to do so, and that's not an equal protection violation. I, you know, again, would want to research it some more, but if you just said 0 to 18 or 0 to, you know, 2 to 21, and you were separating out a subclass of people.
Oh, and I was saying all adults and
Yeah,
everybody
okay.
order, not
Okay, all adults. Yes.
everybody when they're not seated at a table order, not trying to pull anyone out. But I appreciate the, yes.
Okay, and so certainly same issue. Of course, we have mask mandates similar to that. Again, just to be clear for those watching, you know, you treating bars and restaurants differently is also an equal protection issue. So again, you know, if it's all adults or everyone 2 and above, I mean, we had a mask mandate like that before. Obviously, we can do that again. You know, going back to the question of, you know, again, a mask mandate from 2 to 12, you know, I think that is something, you know, across the city, you know, excuse me, across the county, a countywide mask mandate for 2 to 12. You know, certainly there's some exceptions in there for religious and health and all that stuff that we typically have. But I think that's something you could do, and it would apply obviously to the restaurant, to the Walmart, to the school in theory, and in the preschool. You know, I would note again with the caveat we discussed very early on about whether or not it is applicable in the school district and whether or not they'd have to follow that for a different, you know, a different discussion, but we'll note that again. But I think we could certainly do that. I'd obviously want to have a little time to, you know, work to get an order we thought could be defendable, you know, based upon your direction.
Commissioner Reed, I just wanted to add earlier that I think I'm in a similar place as Commissioner Kelly, that right now my primary focus is about young people who are not eligible to be vaccinated, and being very legitimately concerned about the reasonable expectation that's there. We could see surges in that and positivity in those age groups upon school beginning. And so I think that that's really where my focus is at. I hope to continue to kind of be in contact, and I know staff will certainly be with health officials about if those numbers really begin to change quickly, how we bring that conversation back here.
This is Brad. I forgot to add, just so we're all on the same page and not necessarily recommending it. You know, now that SB 40 has been held unconstitutional, you know, the health officers can issue an order without the county commission, you know, issuing an order. And so it is, again, not speaking for the health officers or otherwise, they could issue an order that started on Friday without you meeting. Corollary, you would have the power to issue an order without them, even if they didn't recommend one to you. You know, again, at some point, if SB 40 comes back into effect, that requires a recommendation from the health officer and a decision by you. That is the safer path, because if SB 40, you know, all of a sudden in the middle of the week gets reinstated, you know, you'd have a confusion there if the health officers issued an order that you haven't approved. But I just wanted to make sure you understood technically those options are on the table.
I really appreciate that. And while I appreciate that SB 40 is not active now, and I hope it never comes back, I do think it's also important that we work collaboratively with our public health partners. And so I would love to hear from my fellow commissioners, but it'd be my preference that we have an order come from our public health officers and we have the chance to consider it as a commission, just so that we can show our community that we're working collaboratively as a leadership team around these things.
This is Commissioner Reed. I would agree with that for that reason, as well as I think that this county commission meeting is someplace that much of the public is looking to for conversation about this on an ongoing basis. So with all the legal confusion and changes and lack of clarity, it's a safer bet for us to just do it in collaboration, like Commissioner Portillo said, and it gives us the opportunity to give a venue for public conversation. And I think that that's a crucial piece of this.
Yeah, I've been very proud of our health department ever since this began and want to continue to collaborate with them. I'm sort of curious to see what happens with our outlying district school boards over the next couple of days, just based on the conversation we've had here. And it'd be interesting to see how that goes as well.
It looks like Dan's been raised his hand to make a comment. Dan, do you have a comment?
Well, it was a thought in my head as we hear from you what you would like to see from public health. And I think back to our previous public health orders. There was more to them than a mask requirement. There was mask gathering limits and other things. And as we get emails today about why are we having these large public events? And not to just make this more complicated, but I would like to know, are you as motivated to see mass gatherings as you are to see a mask mandate? What's the pulse of the commission around that issue?
This is Commissioner Portillo. I will say that most of what I've heard from constituents has been very mask focused, and that has just been the emails and the phone calls that I have received. I would be really interested to hear from Dr. Scrimshire and Dr. Marcelino from a public health perspective and the science around this. If we have a mask mandate in place, is that enough when it comes to harm reduction? Are we wanting to also think about mass gatherings? That's something I'd be open to, but I would like to hear from the experts more on that.
Yeah, I think it's clear the type of events that have been held, whether it be on Mass Street or these mass gatherings or concerts or things, when nothing is being done about that, but yet you're telling kids to wear masks all day, that's hard. It's a hard pill for people to swallow, because they're both high risk events, but we're cherry picking the ones we want to. And that's when you hear the conversations about bullying and what are we, how are we deciding these things? So those are conversations that need to be had. Yeah, there's high risk places everywhere. So you have a packed restaurant, you have a mask mandate, and bars are continuing to operate without masks. It's an issue that is something that's going to need to be teased out. And as we saw last year with all the different orders and mandates, it was very difficult. And that's why I think as a health officer, I've kind of come to the place of we strongly recommend masks indoors. How we get there, I feel like, as in your position, you're better suited to figure out how we get there. We've recommended it. Now applying it is not my expertise. That's kind of where I'm at.
Well, and I do think that this goes back to something that Commissioner Reed said earlier as well about the opportunity for vaccination, that for many of these larger gatherings, some of those are gatherings by adults who had the opportunity to be vaccinated, which is very different than places where children have to be because it is mandatory that they have an education. And so I think that there is some of that opportunity to be vaccinated versus mandatory participation. So I would feel better about focusing on masks at this point than focusing on mass gatherings.
And if I can jump in here too, I just want to add that Unified Command is continuing to meet and monitor our community situation. And I continue to be in very frequent communication with Dan and his team in terms of this. So I think this is something we will, as we have been doing for the last year and a half, continue to monitor. And if the situations in our community change, that we feel that different measures need to be taken into place, that we will be back before our public bodies and the commission to do that at this time. And I think that the criteria put forward is a way for the community to begin to signal some of those things. Being in yellow indicates that things are different. There are trends upward. And I think this just makes us mindful that we can bring this back to the commission at any point in time as we see information changing related to what we think is best for the community.
So it sounds like where we're at is that our public health officials will go back and consider all of the information that we've heard with the hopes that they would come to us with a recommendation around a mask mandate for 2 to 12-year-olds. And then we will consider that at our meeting a week from today, because everything will be in our packet by the end of this week. And the public will know that they can come have that conversation with us next Wednesday. Is that where we believe we are all
Sounds
at?
good to me.
Cool.
Yeah. Yes, I'm just processing what you just said, making sure I think what's really critical is that our legal and our health department take a look at this order. I think this is where we're leaning. I think we sort of put parameters that it's this 2 to 12 age group. I think we as adults have a responsibility to care for our young people. And these are the CDC recommendations. And I think I'm disappointed in some of our community leaders who have chosen not to follow those recommendations and protect our young people. And so that's where my heart is. So I just want to make sure that we've given our health out. We're not telling them what to do. We're not telling legal what to do, but we're giving them that space. And we'll be looking forward to their conversation next week.
And I appreciate you allowing staff and legal counsel and the health officers time to work, to review it, to pull the information together, to look at drafts and within this broad framework and parameters that we can bring something back to the commission next week. I think that's all we really need. That's definitely a lot of direction for us as a team to move forward.
Great, thank you. And thank you so much to all of our public health team and legal team for being with us this evening and being a part of those conversations. Really appreciate it. We will move on to appointments. And I believe we do have an appointment this evening.
Yes, commissioners, actually you have a couple. You have an appointment for the Bicycle Advisory Committee and a reappointment for that. And then there are 3 vacancies on Fire District 2. I have names for 2. I think we'll have names for a 3rd soon. But I believe Cam Jacques, I'm going to say the name wrong, is eligible for reappointment to the Bicycle Advisory Committee.
I would move to reappoint Cam Jacques to the Bicycle Advisory Committee.
Second.
All of those in favor, please say aye.
Aye.
I don't have the other 2 names, Sarah.
So for Fire District 2, which is the fire district over Palmyra Township, Deborah McTaggart is eligible to be reappointed to her position. And then there's a vacancy in position 5. Bill Winger is no longer able to fill that role. And there's been a recommendation to appoint Bill Stark to that unexpired term.
Sarah, can you repeat Deborah's last name again?
McTaggart.
McTaggart.
And
Bill Stark.
Yeah.
And those are both for Fire District 2.
Yes. And then there is also a other vacant position, but we want to make sure we get all that information. And I hope we'll have that next week for you to fill up Fire District 2.
Does that mean, would you prefer to just wait to appoint all three of them together or?
Actually, I'd like to get the 2 that I know
Okay.
now.
Just wanted to make sure I was clear about that.
Yeah.
Commissioner Reed, I move to approve Deborah McTaggart and Bill Stark, both to the Fire District 2 board.
Second.
All those in favor, please say aye.
Aye.
And I believe those are all of our appointments for the evening. Great. We will move on to miscellaneous. Sarah, what do you have for us?
Commissioners, I have a memo in your packet. I just want to remind commissioners that we have the primary election canvas next week. And can all 3 commissioners attend that event? Okay, great. And in addition to another drug court graduation, which is really exciting, coming up at the end of the month, that's in that memo. Also, there's a flyer attached. Douglas County Emergency Management is partnering with KU Emergency Management to schedule National Incident Management System training for elected officials, appointed officials, and high senior executives and agency officials. There are 3 dates over the next 3 months or next several months. I highly encourage you to attend. And if you could just keep us posted if you're able to attend which one, so that we can try to keep track of Open Meetings Act issues. And that's all I have for commissioners today.
I will just say I am very grateful to our community for coming out on Sunday to discuss a public defender's office. We had a really great, a lot of public comment, and I really appreciated all of the input that folks gave. And so I'm excited to see what happens at the Kansas Board of Indigenous Defense Services meeting this coming Friday, and how that will hopefully impact our community long term. So I'm just thankful for the community participation.
This is Commissioner Reed. I just want to take the opportunity to acknowledge here in this public meeting that I was signed up to provide public comment and had hoped to attend Sunday to the bids hearing, but got pretty ill on Sunday, and then also was ill Monday and unfortunately missed Affordable Housing Advisory Board this month, which was disappointing, but my brain was too foggy, unfortunately. So I did watch the bids public hearing live and was appreciative for how many folks came out and provided public comment. I'm excited to hear what their review and kind of answer to that is. And also, since it was a topic of conversation this evening, with COVID testing, I just wanted to take the opportunity to share my experience. I've had a couple of COVID tests over time. I have not had to get tested since being vaccinated at the start of this year, but both my partner and I were feeling pretty symptomatic and got both rapid tests or the antigen tests and PCR tests. And I just wanted to note that was about as simple and accessible a process as it could be. And it was really easy to schedule that online. And I appreciated the opportunity, obviously, to get some quick results, and got a negative result, and then decided to do that PCR test to ensure that we didn't have breakthrough cases and wait a couple of days for that. And it was just really accessible. So here in Lawrence, on the public health website, there's a number of locations, and most of them are pharmacy based, to go get tested. And then there's just an easy website called gogettested.com, which makes it really simple to schedule either test. I did both tests in the same day. After getting my negative rapid test, went back for the PCR test, and it gave me some peace of mind. And also had a conversation with the person who took the test that said that they were grateful for more people getting tested, because it helps us have that data and info both locally and at the state and federal levels. So I just wanted to share that experience and make sure I mentioned that website for anybody who's feeling symptomatic or knows of any exposures, to try and take some time to go get tested. And it's gogettested.com.
If no one else has anything, we will adjourn for the evening. We're adjourned. Thank you.